Thank you so much. At the outset, I would like to thank Professor Jaipur for inviting me to be part of this important meeting and providing me an opportunity to deliberate on some thoughts, my thoughts, in the context of core competencies in public health to address the challenges in sustainable development goals. What I would do is that because in this particular session, Thomas and I were supposed to speak. So some of the issues that Thomas was planning to cover, I would not speak about that because that has already been talked about, particularly the global framework for universal health coverage and the European framework for competencies for health workforce are critically talked about by Thomas, and therefore I will not touch upon those issues. What I will do is that because there are several competency frameworks in the context of public health, and it may not be possible to talk about all these. So what I felt is that I would give a broad view of related issues focusing on public health competencies. And in yeah, I would begin with these three familiar reports. I'm sure that all of us have at some point in time must have confronted with these three reports. Last century, the Flexer report, which focused on reforms in medical education, and then we have Welch-Rhodes and Goldmark reports talking about the reforms necessary for the nursing profession and the public health education. And what happened is that previous century has witnessed ushered groundbreaking reforms by linking science with the curriculum at the university-based schools. And that has really improved upon life expectancy in the last century. At the beginning of this century, what happened is that the Lancet Commission, which was called as the Commission on Education of Health Professionals for the 21st century, undertook the landscaping of education for three professions: medicine, nursing, and public health. And they looked at it from a very different perspective. They used a multi-professional perspective. They also used the systems approach and tried to link and find linkages between education and health systems. That was the focus of the Lancet Commission recommendations. But having said this, that the last century has witnessed those three critical reports which have really improved the health situation and the life expectancy. What is the situation at the beginning of this century? The health professional education has not really kept pace with the 21st century challenges. And therefore, one of the key recommendations that have emerged out of the Lancet Commission is that what is clearly needed is a thorough and authoritative re-examination of the health professional education, matching the ambitious work, the Flexner and other related work that was carried out in the previous century. And what they talked about is that we have seen in recent past, I would say the previous century and at the beginning of this century, three generations of educational reforms. At the beginning of the previous century, we had looked at the science-based focus with scientific curriculum and university-based structuring in that way. And in mid 1960s and 1970s, we had seen the problem-based focus, the focus on problem-based learning, and institutions were recognized as academic centers. But what is thought about is that somehow, unfortunately, we talk about the competencies for health work separately, and we talk about the competencies for more educational programs and graduates separately. But at times we forget that there is a clear-cut linkages between what we teach into the classrooms, because these are the professionals for tomorrow. And from that perspective, it is clearly important that the health systems, as a healthcare service delivery system, I would say, must actually align and have clear linkages from the competencies perspective with our educational system too. And from that perspective, what is being talked about, health education systems platform that is being made available, and which actually highlights upon the competency-driven curriculum for the current century. And they talked about two types of reforms. One are called as the institutional reforms, and therefore they say that there is an institutional design which needs to be looked from the perspective of reforms, and another is the instructional design, so instructional reforms. As a part of the process that how education is imparted, we need to look at from the institutional design perspective, the competencies are very clearly outlined. But as rightly actually Professor Gupta just mentioned, they're talking talking about in isolation is not going to help. You cannot only talk about competencies and forget about the faculty development or the pedagogy or the curriculum and content and the enabling ecological environment that is required to implement a competency-driven curriculum. And from that perspective, it is very important that we have to see the linkages and from the perspective of interconnection between all these issues. And therefore, what is required is emphasis on transformative learning, which is considered as one of the most fundamental drivers for health professional education in the current century, and I will emphasize on that. What does it mean? When we say that transformative learning, what does it mean? Actually, we have to see the levels of the learning. The first level of learning is informative learning. When we talk about a transformation, a transfer of information and skills, and that would produce experts. But when you talk about another level of learning, that is the formative learning, it actually inculcates and incorporates the socialization and values. And that, in addition to the informative learning, would create professionals. But we have to move a step further forward. We need a transformative learning where not only that the information and formative values and moral and ethics and socialization remains important and critical, but we also need to see that the graduates that we are producing, they are actually true leaders. They become the change agents in the society. And that perspective, we need to see that how do you bring those leadership attributes as part of the competencies that they acquire as part of our educational programs so that they become the enlightened change agents and then they transform the system. From that perspective, actually, the focus of transformative learning should be kept in mind when designing and developing the competencies for the public health. Transformative learning brings three important shifts when we talk about transformative learning. The first is that moving away from the fact memorization to searching, analyzing, and synthesis of the information for decision-making purposes. The second important shift is from seeking professional credentials to achieve the core competencies. You go to the job market, and labor market is the terminology that we don't like, but you go to the labor market, and I was talking to someone, he said that in the pharmaceutical industry, he wanted to hire someone having the capacity and competence of analyzing the data from the cost effectiveness and the health economics perspective. And then he also said to me, I don't care whether the person has a diploma or a degree or a doctoral degree, because I'm not going to hang those degrees on my wall. I want a person who is able to do that. You know, sometimes people, he said, that would be able to write an essay on health economics or one question on undergraduate programs or postgraduate programs on cost effectiveness, but when actually the data is provided to them, is that person able to do the analysis and undertake competently the health economic analysis? That's the perspective and point here. From non-critical adoption of educational models to the creative adaptation of global resources which are available for the local priorities. And for interdependence of an education, when we talk about, then there are again three fundamental shifts which talks about isolated to harmonized education and systems to standalone institutions to network and alliances and consortia. SEAPHEIN is a brilliant example. And India fail also in India, and there are several examples where it is clearly important that we need to collaborate. We need to create and effectively and efficiently utilize these kind of resources for advancing the larger agenda of public health. Inward-looking institutional preoccupations to harnessing global flows of educational contents is another important and relevant issue. And it's not the only Lancet Commission. If you talk about several reports which have emerged in the last decade or so, you would find that all of them have recommendations on similar lines. And I just wanted to mention one of them. But let's get back to it. And one of the important transformative learning component remains that we need not only the competency-based curriculum, competency-driven curriculum. We should replace the word competency-based to competency-driven, because the whole curriculum should be driven by the competencies, and that's what actually should be the purpose. We all understand that competency incorporates knowledge, skills, abilities, and attitudes, and from the perspective of knowledge, it includes understanding the facts, procedure, concepts, and theories. From the perspective of skills, it includes capabilities that are learned, that one brings to a task. That's an application of knowledge. And the abilities includes being able to accomplish something that is a trait which is innate that enable one to perform. That is more important. And then of course, the attitudes, which talks about the emotions, beliefs, and values that motivate behavior. This is what the competencies is all about. And when we talk about core public health competencies in practice, it is basically a consensus set of knowledge, skills, and abilities needed for the practice of public health. That is what is the core public health competencies in practice. which should also focus on behaviors that could be observed and has to have relevance to the particular context. Sometimes people say that ASPH or European model or Canadian model, Australian model, there are different models available for the competencies. We need models in our own countries which are contextualized to our own concerns and challenges that we confront in public health. And it should not be limited to a single job or discipline, because we really do not know the graduates that we do produce where they would land up. They might get into institutions where the teaching and training is predominantly carried out. They get into health systems where they may probably be involved in program management. So the kind of competencies probably would required should be from that perspective we should ensure. So what are those public health competencies? It's the foundation skills desirable for the professional engaging in the practice, education, and research of public health. That is what is the public health competencies, because mostly the practice, education, and research would classify them into four categories. And the simple question sometimes asked is that everything in the public health can be, from the competency perspective, can be put into four buckets. What do we expect our graduates to do? There are only four things that we expect them to do. One is that they should be able to define and describe the problem. Second is that they should be able to design interventions as in the form of solutions to solve these problems. Third is that they should be able to implement these interventions and solutions. And fourth is that they should be able to monitor and evaluate those interventions. So you take any core discipline from epidemiology and biostatistics as a tools to the management and anything, you would fit into all those competencies in these four buckets. These are the four things probably if they are able to do, they are able to practice public health in all aspects. The core competencies therefore are required for employees in all positions throughout the public health systems, and typical domains could be, and this is one example, there could be other examples to look at what kind of typical domains could also be there. So why do we need core competencies? We talk about in the context of public health otherwise also, for identifying the needs of public health professions and the government to improve the delivery of public health services. Because that's an ultimate objective to the public health that we wanted to deliver healthcare services. Develop the curricula for the training and teaching programs that we implement in our institutions, and support the workforce development, recruitment, and performance management, creating the competency-based job description. These are the purposes that why we need core competencies. And putting up them into a context, one can say that first thing that we probably needs to know is that the public health functions. Because they are aligned, those public health competencies are need to be aligned. What you are supposed to do is known to you. Then you can design and then you can develop a framework for the competencies required for delivering on that particular job. And therefore, this public health functions defines what public health functions and services the government should provide for its population, and based on that, then provide the basis for competencies. And we should always keep in mind when designing the competency framework that what are the functions that our graduates are expected to undertake. And from that perspective, the public health competencies then include the set of these knowledge, skills, and abilities and attitudes that public health professionals would require to perform a particular job. And that gets translated into a competency-based education where the knowledge, skills, abilities, and attitudes of the students can be assessed on how to show them they are ready to meet the needs of the workforce. So how providers are trained is reflected on this particular part. Let me give a few examples in Indian context because we have colleagues from different parts of the globe in South Asia, and therefore it is important to see that there are certain efforts. SEAPHEIN effort was at the later part of the previous century, and then even WHO played a very important role in creating that competency framework. I will speak about last few years because I wanted that context of UHC and SDGs. One needs to understand before that the variety of the programs that are being offered in public health in India. These are the numbers, these are the number of institutions not relevant at this point in time, and annual intake capacity of these institutions in India. But if you look at on the left side, like in an MBBS program, we teach community medicine as a subject. And we have public health teaching as a part of the community medicine program. Then we have MD programs, diploma in public health, and MHA, and there are other diploma programs, and MPH is there. And these specific programs are also there, like in epidemiology, health administration and management. IHMR is doing wonderful job in offering programs in the context of health management, health and hospital management, public health management. So variety of the programs being offered, and therefore, for designing a competency framework which is specific to a program, it would be a variable from one program to another program that keeps me in the mind. I wanted to summarize the three critical reports that we produced in last few years in this country, where we undertook the situational analysis of variety of the programs in India, and this India report is actually an outcome of the 5-country situational analysis of medicine, nursing, and public health professionals. All these reports actually dealt with the competencies. I will give a few examples. That this is an example where we actually designed a cross-country comparison of master's and doctoral level public health programs with a focus on competency-driven curriculum, where we had India, China, Bangladesh, and Vietnam being participating into the whole process. But not only the landscaping of the curriculum was carried out, but we looked at critically what kind of competencies are currently being incorporated as a part of these programs, but also looked at what are those employers' expectations from the graduates that we produce. Because finally, employers' expectations will have to be matched. We produce the graduates, whether they are able to deliver to the satisfaction of the employees remains an important question. The 5-country situation analysis, which included India, China, Bangladesh, Vietnam, Thailand, was supported by China Medical Board, and then Rockefeller Foundation, and then even WHO, CRO region, supporting this analysis, where again the competencies are looked at for 3 professions where the competency model is available. Another example is this GEMNet Health, that is Global Evaluation and Monitoring Network for Health. And what we looked at is that we developed a core competencies for monitoring and evaluation track in South Asian MPH programs. When we looked at the South Asian MPH programs, which are offering them track in the monitoring and evaluation, it was specific to one aspect of a particular program that we looked at. This is another interesting work that was supported by the WHO Country Office, but was undertaken by Indian Public Health Association. Professor Pandau from AIMS that time led this effort, where we looked at the competency-based public health training in undergraduate medical education. Much needed paradigm shift in India, and actually as a follow-up of that, and then I will talk to you, but then now currently we have the MBBS curriculum, which is a competency-driven one. This is very interesting that last year, only 17-18, the government of India had constituted a task group which was assigned the responsibility of designing a model course curriculum for Master for Public Health in India. Because currently we don't have a professional council that deals with the public health programs in India, and therefore the government wanted that some standardization and some prescription actually, with the universities left with their choice and freedom to tweak around, but some standardized program, and this was developed, which also includes basically competencies addressing UHC and sustainable development goals. But when you talk about educational approach towards designing competency, we also need to relate and talk about the health workforce approach, and Thomas talked about in great detail on that, but engaging with certain states to identify what are the needs and what are the competencies for public health professionals in those states from the perspective of the state managers. So this is also an important piece of work. And the one that I was mentioning to you, that the Medical Council of India took an initiative to design a competency-based undergraduate program, and community medicine being as one of the subjects. It has also its own competencies being clearly spelled out for the community medicine program. Most of all these frameworks, what they do is that they follow these 5 steps. One is that first identifying the areas of public health practice and core public health functions. So we should be able to see that what they are expected to do. And then based on that specified core learning outcomes to effectively perform those identified public health functions, and then you capture themes out of that and then identify the core domains that address the common learning outcomes, and then you finally have the stated competency statements, which are finally aligned with the competency statements with core domains like in epidemiology or management or health systems. There are even global efforts, and then European ones presented by Thomas, so I'm not going to into detail that. I will mention some of the issues related to the core competencies for public health professionals. This is the one of them, which was 2014, which was published, identified these core competency domains like public health science, assessment and analysis, policy and program management, financial management and budgeting, the partnerships and collaboration, social cultural determinants, communication, leadership, and these are being identified as key public health competency. And each then domain has been put into, like, just take an example, a couple of them, like public health sciences, looking at using the behavioral and social sciences, biostatistics, epidemiology, environmental public health, demography, workplace health, and prevention of chronic diseases, infectious diseases. So they have actually then spelled out clearly the competencies within each of these domains. Like, for example, the social and cultural determinants would have to interact effectively with diverse individuals, groups, and communities, embodying those attitudes, values, and practices that lead to the equitable and inclusive behaviors, practices, programs, and policies. So those kind of then clearly spelled out activities, leadership, communication, can be clearly identified. One has to relate it. When we talk about competencies, we must relate them with the job opportunities available in the market. Because finally, although the ultimate objective is advancing public health, however, it remains the fact that we want our graduates to be placed in the jobs which are available in the market. Whether they have those prerequisite competencies when they get into the market remains an employment is important. And therefore, we did the mapping of public health jobs in India and trying to understand that what kind of jobs are available, what kind of salaries are being paid, what kind of competencies are required from the employer's perspective. Then you go to the employer and check with them that if you wanted to hire MD community medicine or MPH graduate, then what are the competencies that you are looking for? From that perspective, the other is the career opportunities and then the public and job opportunities in India from the employer's perspective. So this also actually an input to the competency, designing the competency framework. Because we must realize that we are preparing students for the jobs which do not exist today. The world is so rapidly changing. We are preparing our students for their future and not for our past. As faculty and professors, sometimes it happens that the way we learned, we wanted to communicate and we wanted to teach. But we have to keep in mind that if we teach today as we taught yesterday, we rob our students of tomorrow. That's the fact and reality. Because there might be certain jobs like big data analytics currently providing certain opportunities for our MPH graduates. But 10 years back, 20 years back, probably when I studied, we never thought that those kind of opportunities could be there. But now, handling these big data sets, where are those competencies and skills which are required from the perspective and employment that probably we will require to do that? And therefore, 21st century skills would also include communication, collaboration, problem solving, thinking outside the box, decision making, proactiveness, self-reflection, critical thinking, creativity. All these are critical skills. It's not only the core skills, domain-wise are critical, like management or epidemiology or biostatistics, but these cross-cutting skills are equally important because these soft skills are going to make them a street smart public health professional standing in the market. And from that perspective, we need to understand. And the last few minutes, SDGs, and it has been talked about, so I will not get into much of the detail. But goal number 3 is important. We all understand that, and we always have a focus that the good health and well-being, and from that perspective, a graduate should be competent. But we also need to realize that even several other goals also, so cross-cutting actually. You take an example of zero hunger. We all know that it's linked with climate change, or gender equality. All those goals you would find there is a cross connections, and therefore the trans-sectoral approaches remains very critical. And therefore, while designing the competency frameworks, we will also have to look at this transdisciplinary nature of a discipline. Because we all understand public health is a discovered discipline. It's a fusion of several disciplines for that matter. And therefore, these trans-sectoral approaches would provide applications for our public health professionals in much more wider sectors. And from that perspective, we should look at designing competencies. And therefore, they are all working in the public health system by different nomenclature and performing different functions, like, for example, health promotion to program managers, to data managers, to occupational health nursing professionals, to public health physician, to the health communication specialists, to town planner and trade experts for that matter. All these are critical and important, and therefore we should keep in mind while designing the competencies for it, because we all understand what influences the health of the people. The Sir Michael Marmot tells us that the conditions in which we are born, grow, live, work, and age, all they have influence on our health. And from that perspective, we all understand that it would require a very multidisciplinary, multi-sectorial, and multi-layered approaches if we wanted to really advance public health. And from that perspective, public health requires approaches beyond the health sector. I will give two quick examples. This is an example where policies in other sectors are important. And unless we actually deal with them, and I'm very happy that you mentioned in the morning that health in all policies. And from that perspective, Sanjay Basu's from Stanford tells us about the smoke-free laws and increased taxation of tobacco products are the most effective strategies in reducing heart attacks. And this is WHO World Bank, everybody tells us about it. But he modeled the data for India, and he tells us that if we implement smoke-free laws and tax every tobacco product appropriately, we would be able to avoid 25% of the heart attacks and strokes within a period of 10 years. And that will have more impact than all the drugs that a cardiologist of this country would prescribe. From that perspective, no. See, dealing with the smoke-free laws and taxation is a transsectoral policy which are critical and important. If we impose 20% tax on sugar-sweetened beverages, it will be able to prevent more than 11 million cases of overweight and obesity and a sizable number of cases of diabetes. Air pollution is another example. We have 1.6 million premature deaths attributed to the air pollution in this country. We have 49 million disability adjusted life years attributed to the air pollution in this country. If we wanted to deal with the air pollution, probably the competency that would require would be completely transsectoral. Because it's not that within the health sector that we can do anything for the air pollution prevention from that perspective. And therefore, assuring health requires approaches beyond health sector, and it should reflect in our curriculum and competency. Otherwise, we would not holistically would be able to deal with the public health related challenges. Universal health coverage we all know about. What I wanted to say is that what health assurance to me is that, of course, the universal health coverage, which talks about the financial protection and then you need a functioning health system. But beyond that, we also need to do that and address the social determinants of the health. So the UHC, the social determinants of the health, that actually translates to the health assurance. Because finally, we need to understand what health assurance is all about. Health assurance has two words, assurance and health. It is the assurance to the people, because I'm talking from Indian perspective, it is the assurance to the people of this country about their health. The health they dream, desire, deserve, and demand, because we are in a democratic society. That should be kept in mind when we design the overall program. And therefore, if we wanted to really shift the slogan, health assurance should provide an opportunity to respond to the aspirations of the people of this country, and that would help us also to advance the agenda of sustainable development goals. To have a curriculum as a competency-driven program addressing these issues would help us to take away from the advancing public health challenges, responding USC, responding SDGs. We need to keep in mind, if you don't know where are you going, any road will you get there, and therefore, the underscore importance of and relevance of competency stands there. Thank you so much for this opportunity.
Thank you, Professor Sanjay. So, any question to Professor Sanjay regarding his presentation?
Thank you very much for taking us through a century and the whole spectrum of the last century. Lancet report has mentioned everything which we dream of and which we should have for 21st century. But again, the problem is that where do we stand? And are we changing ourselves? Are we transforming our education in that direction or not? Like in view of the countries in Southeast Asia, like country like Nepal, having a population of 30 million, and we have got 22 medical schools, and the quality of education is always a question mark every day. And the another question is that you said, and we all know that it is a multi-sectorial approach. Then who should qualify to be a public health professor?
I think it's a very constructive conversation. I just want to know how integration, transformation, and universality, these three things will be ensured throughout the integration, transformation, and universal in the flavor of SDGs. How it could be incorporated in this service area.
Thank you very much for very elaborate explanation on the competency frameworks that are more applicable to our country. My concern is more practical. I know in India currently we are offering different types of degrees, starting from bachelor degree in public health to master's degree in public health. That's one extreme, one stream. Then we have several courses where we offer masters in business administration, health and hospital. And then we have MD degrees or MHA degrees. These are three different, similar, different, People use them loosely as synonyms, but they are not. And the focus of these education is different. And therefore, the set of competencies that needs to be defined uh, should be different. So a master's program will have a different set of competencies as compared to MBA program. That's the distinction I wanted to understand. What's your take on that? The other point here is that when you were giving us the examples, most of the examples were like, for executives or managers. While we not only need people who can execute programs, I mean, define problem and design solutions and implement them, but beyond. So some leadership qualities so that they can look into future. So I think while working around these frameworks, uh, maybe we need to be careful of these issues that surrounds them. Thank you.
I think excellent presentation. Congratulations. Uh, we are talking of competencies which have to be delivered to the future generation, the students of different levels. I'm saying where are the teachers? What about the competencies of the educators? You may list out anything. You may list out and give them anything, but if you have the same old-fashioned teachers who are themselves not so motivated, are not having leadership qualities, got into community medicine or public health because they could not get into the admission into the other area of clinical practice or clinical area of their choice. So they came by default into community medicine or public health, not by choice. And those who really want, who have been into other streams like pediatrics, OBGY, even look at Dr. Reddy, who is a cardiologist, but started to pursue public health and work for public health. The public health or community medicine community created firewalls around them in many countries, saying that no, you guys are different, we are different. Stay away. We will not even give you membership. So we have, I think we need to create first the advocates, champions who can take it forward. And if we don't have that, no matter how many books we produce on competencies, business will be the same. And we'll again have the same level of people out. So garbage in, garbage out. And many of the, pardon me for saying it, but many of our own professors of community medicine who many papers in many countries, they don't even know how to write it. And you ask them to really teach them how to do data analysis on SPSS and on STATA. How come somebody who comes as MP from Johns Hopkins or from London School of Hygiene and Tropical Medicine is always a star and is always grabbed by all big organizations? But the MPs which we produce in our own countries land up with very few thousands jobs. You know? So I think that's where we need to change. Don't think of reforming only education, think of reforming the educators as well.
Any more question or suggestions?
Yeah. So in line with thank you very much. It's a wonderful presentation and then able to understand most of the things. The thing is, as we also enlightened, now that we have a variety of professionals that are even teaching community medicine that for the undergraduate medical curriculum and then even other nurses and midwifery and all these things. And also we have public health professionals that are only teaching public health. So then with this, all these, and we have a main problem of these competencies, how to deliver, because the curriculum, we are competing with other people are delivering. If we are taking this MPH, But then when we are delivering things in the undergraduate or possibly in the medical curricula, or maybe in the midwifery or nursing, or maybe even other curricula. So where how we can fit on, and also even these competencies, how we are going to implement and monitor these things are delivered, and then the proper skills are really that for the students or teachers they have gained after this year. So all these things we are not very clear.
Sure.
I think very brief observation. Okay. A very brief observation of Jodhpur's excellent presentation. I think 2 or 3 points need to be made very clear. One, of course, is whole discussion and debate is for those who have chosen public health as a career and who have come here by choice. And I also don't fully agree with Madam when she says that most of the teachers were really not inclined and not really wedded to the discipline of public health. I think we also had teachers in the past who really were very inspiring. So, of course, the proportions vary, but the point which I am trying to make is that this whole discussion, the whole debate is for those who have come here, who have taken public and professional choice. That's number one. And still we have teachers in the past who really shaped the course of community medicine education, various universities. Unfortunately, the number is dwindling. Second, I mean, your presentation was very excellent, very exhaustive, but I think we are racing against time. Look at the SDGs, look at NPs is already gone. And if you look at the targets of NHPs, most of the targets have to be met by 2025. Keeping that in view, I think we need to prioritize what are non-negotiable competencies that we must want to see in the public health profession, number one. And then we also need to have a roadmap on acquisition of those competencies. So we need to prioritize, we need to define what are the non-negotiable skills for public health students or public health professionals, which we want inculcated on priority basis.
Thank you, Dr. Zodpey, for a good presentation. Yes, the competencies, as we have seen, that knowledge, skill, and attitude, these three has to be integrated and delivered. But in our setup, it is easy to give knowledge. We may try to simulate and other things to give the skills, but we are lacking very much in attitudes. So that attitudinal development is a real challenge for us.
Try to. So, what Dr. Zodpey said, actually, I have to agree to that, and that's a challenge that we are confronting. But with the change in, the more transformative way of looking at the education, I think we need to focus on attitude, and that's important. I have to agree to that, what you said. Nothing to add to that. And I also agree that a lot of people, as teachers also, who have come by choice into the community medicine, and that is perfectly. We all have examples and role models for us, and from that perspective, it is important that people have come choice, and therefore they would perform in a better way because they have a passion, they have enthusiasm, and that would make differences. Racing against the time. We all against all the time. Generally, we have a limited amount of time. We have to see that what the best we can do, and non-negotiable skills and competencies. I think that the effort of the government of India to put everything together to create some standardized curriculum with clearly spread out some skills. I think that's a good beginning with. At least government of India. Because generally education is thought about by universities, professional councils, but the ministry taking an initiative, creating a standardized curriculum, and the ministry actually participate in the whole process. I think that can be looked at from that perspective, and obviously roadmaps are important and critical, and they are to be looked into. The few questions are there that we also mentioned about how are we transforming, and somebody also mentioned about the quality of education. That's a challenge globally also, but particularly this region is experiencing a serious challenge. We have, when we talk about education, we talk about expansion, excellence, equity, and employability. These are the 4 E's which are extremely important for any education. Expansion, I would say, happening particularly in India, I would definitely say expansion is there. Equity may be partly the government is trying to see that how best way it could be respond. Excellence remains a question, and I fully agree our higher education, particularly not only to the public health and the field of medicine, but we have few islands of excellence sitting on a sea of mediocrity, and that's the fact and reality. But now we have to see that how do we improve upon that, and it's not one individual's responsibility. Of course, we need champions, we need actually torch bearers to say that these transformations are really critical. Question actually about the quality of education, and that's cross-cutting. It's not only the public health. Say that any nursing profession, nursing education is in champions in India. I would say that nursing, 90% of our nursing institutions are in private sector, and some of the institutions that the way they are run into, from the quality perspective, remains an important challenge. Then we said also the public health that multi-sectoral approaches, and who will do that? Public health professional. I would say that public health professionals should have those competencies. Even as a public health professional, that person should have the competency of looking at the taxation policies of the government of India, engaging with the revenue ministry or the finance ministry of the government of India, and push them to the corner for taxation for tobacco products or junk food or sugar-sweetened beverages. Because unless we create that evidence and we present it to them, it's not going to work. So the public health professionals will have to have those competencies. For air pollution, every year, this time there is a debate in Delhi. And when you talk about 1.6 million premature deaths, 9% national disease burden, 49 million disability adjusted life years, they say that's fine. But if you talk about the impact on the economy of the air pollution, ambient air pollution, we actually estimated $30,700 million US, that 0.5% of the GDP in 2018 has been lost because of the air pollution in the country. Then the government is more worried about it. So probably who would do that kind of an analysis? Probably we need public health professionals even to do that kind of an analysis of looking at the impact on the economy. Just giving a couple of examples. I believe that this trans-sectoral policies, agricultural or food security or climate change, probably our public health professionals will have to lead that from the front. That is what my feeling. Integration, transforming, and universal. Big question. Integration, as a health professional education, also one of the recommendations of Lancet Commission. But unfortunately, to teach the students of nursing, medicine, public health, really challenging in this country that we are experiencing. We have many institutions in medical school where the nursing institutions are housed in the same campus. But it is not possible, it has not been possible that we can train them as a part of an integration is concerned. Transformation is important, and we talked about changing attributes remains critical. We have some different degrees and different courses in India, and the competencies will have to be different. How can there be a competency of MD community medicine program the same or for the health management program or bachelor's in public health program? There will be some basic competencies that probably any public health professional will be required to have, but there will be some specific competencies specific to the programs and courses, because we have a variety of the courses and programs in India, and that will have to be there. I fully agree with the teachers and faculty development. That the challenges around that, but we cannot look at competencies again in isolation. As rightly mentioned, that Sir also mentioned actually, you said, sir, about the faculty development, a critical issue. But curriculum, content, pedagogy, the way we teach, generally the way we taught, we got, when I was in medical school, the way I was taught, probably that is how we continue to teach. That's what is an unfortunate story. For the 21st century. Yeah. So that's another issue probably. And I believe that leadership qualities are important, sir. And therefore, we transformative learning. The only difference is that change agents, leadership attributes, which are important. And we need to create. So we need public health practitioners, but we also need public health. We may not need in lakhs, but we need that in sufficient number. So probably that is critical. We need champions. And we understand that sometimes people. I come from a community medicine background. Criticism is fine that we know that we face challenges, but we have leaders in community medicine too, actually. A lot of people from the community medicine medicine background has emerged as the public health leaders of this country. This man is a role model for several of us who is sitting here. He is working in community medicine. So the point I'm making is that, of course, we have challenges, and because public health is so cross-cutting, and then therefore we have people from different disciplines, not only from the field of cardiology or pediatrics or any other field, but even social sciences and biostatistics and demography. They also came into the public health and performed very well, because it's a fusion of several disciplines actually. But there is definitely a scope, and I would like to say, Pankaj is also here, some of the colleagues are here. Now, this one step is that even the Medical Council of India has recognized the need of the competency-driven curriculum, and it is now in the place. And I would also like to say that there is a faculty development, and some of the colleagues have taken a lot of initiatives in actually training the faculty in rolling out this competency-driven curriculum. Because it's not only how you teach, but then finally you will have to assess as per the competencies for that matter. And so that is happening. I would like to mention that that is happening. I'm a very optimistic person, so generally I see positive things, but these are happening, and we should be proud of those things. I think I like to cover all those issues, but if something is required, left, I will speak to you over a cup of tea in the tea bag. Thank you.
I would like to make a very small comment on this, in response to the point which Mr. has mentioned. See, we may talk about it, that how and what kind of teachers we have, what needs to be done. But it's all a matter of who is going to take the leadership and where the buck stops. We have seen that a lot of competencies have been listed out, and there was a lot of focus on what can be done, including it has been going on for years, what has to be done now. But finally, it is very important that the people who are there in public health, they have to have a being of love, empathy, acceptance, inner happiness, self-responsibility. The people who are somebody whom you can lead when they are not requiring any supervision, who are like a light to the others, who are like service-oriented, seva, compassion, equanimity, non-judgment, and non-reaction. Because we know that when people are going in hospitals, it's not about only the medical doctors and the nurses, it is the whole ecosystem. If that is powerful, that is enabling, then it improves the overall quality of public health. So how to create that happy and fulfilled people, and also the people who are not in so much of restlessness all the time, who are restful and still they are going in the right direction with the right set of mind. And what Madam was sharing that about the teachers in India, we tell there is a transformation from teacher to guru, and guru is the highest stage of teacher, and guru means that somebody who is able to remove the darkness. So when you talk about guru, you see that there is a person who is able to remove the darkness, and the first prerequisite is that are you able to remove the darkness within you? Because we all have the guru within us. So how to get evolved to that level, and then the right kind of being happens on its own. In India, there was a Gurukul system where the teacher, the students were there, they were taught as per their competence. Like there was Arjuna, a character who was very good in archery, so he was chosen for that. Similarly, there was a Bhima, the character, he was good in mace, so he was taught for that. So it is a job. If you want to really create the world leaders who will not make a difference in India but all over the world, we need to assess that competency framework right at the time when the student take admission or even before that. And then nurturing them over a period of time. And also putting in a very good dose of life-related skills. When I went to the Johns Hopkins with Sir last time, I was very happy to see with Mr. Farooq Day and also Sunil Kumar, who told that they have created a center for life goals. I believe that we all have also to create that, and this was very popular in India, where people are thinking that only the placement and those small are not the goals, but the bigger goal, that what is the seed of possibility you carry within you. and how you can be nurtured towards that. Suppose somebody is not a seed of possibility of being a public health expert, it is better we should not be wasting our time and energy on that. And it is better to help that person try to become what they can become. So I think our role as educator is very, very important this way. So to know why you are running, in what direction are you running, and when you are running, are you restless or are you restful? Because management is not about managing technology or managing the men, but it's not about manage me. So if the focus is on me, I become the chain master, and therefore the whole onus is on me, and that is the kind of responsibility you take. And so the many of the changes and transformative leadership you talk about, so they will be caught, they need not to be taught. So that is what I'd like to share. So there is a need for techniques like self-awareness, mindful leadership, meditation, inner journey, so that the students are being taught that you are happy and fulfilled right now, right here. It is not someday. Either someday when you get a degree of MBBS or MD, or become an MPH, or when you get joined the PwC or McKinsey Healthcare, then you'll be great. No, you are happy and fulfilled right now, right here. So you have to focus today, fully and mindfully, and that will change the whole paradigm. So in this way, a lot of the inner journey competencies are important, and they will lead to further virtuous cycle. So in this way, only I will not be focused on I, me, myself, my home as my the boundary of my love, but that can still become my center, but not the boundary. In India, we used to say the Vasudhaiva Kutumbakam, like the whole world is the family. And there was another thing that Aham Brahmasmi Tattvamasi. So that used to say that, okay, you are having a light within you and so have the other people. So your level of compassion is not only towards your family, but towards the universe, and which is very much required in a public health scenario. So I just thought to share these software issues of competencies. Thank you very much. Thank you.
Before handing over the microphone to Professor Yadav for making his concluding remarks, I would like to mention one point in response to Dr. Nina Raina, what she has said, that about the qualities of public health professionals nowadays. Actually, in many countries, also in Bangladesh, people think that the public health post-graduation is very easygoing. So the people from medical background and non-medical background, they are admitted in different universities, especially the private universities, and they get the degree of MPH. And in the curriculum, there are discrepancy in the public sector and private sector degrees of MPH. So I think at this point, we can work on, and SEAPHEIN can work on to make or to recommend some of the issues in the curriculum so that a standard curriculum can be obtained by all the postgraduate students in countries like ours. Number one point. Number 2 point is, another one is that in different developed countries, there are licenseship examination of the medical practitioners so that they are very much keep themselves updated with the current trends of the disease and also the treatment modalities. But in Bangladesh and also in some of the neighboring countries, it is not practicing so. I think this is very important for us to keep us updated, and what we were talking about regarding the educators. So I think that will change the attitude of the educators to deliver the best of their knowledge and practice for the betterment of the population. So thank you so much. I thank the SEAPHEIN Secretariat for inviting me here, and we are looking forward. Thank you.
So, yes, I like to thank Professor Sanjay, because it was very interactive session and very important session it was. Because today we talked about universal health coverage and then core competencies, and we all are agreed that we should promote universal health coverage to meet SDGs 2030, and for that
to make that VHC, we need competent health worker or workforce. And for that, you need to have very good curriculum, core competencies and all that. And in my country, still we have conventional curriculum and education system. I don't know other countries, but we all have realized that we have to change our curriculum in the postgraduate. And our sir and madam, they they are 100% correct that it needs lot of work. Definitely, it needs faculty development. Without very dedicated family, we can't achieve core competencies. It is not that we write in the curriculum, and if we don't follow that, then it will not be achieved. Another important thing I'll say is that it is not that what global framework is. That is my thinking. What is global framework, and we should copy and paste in our curriculum. I think we can modify our curriculum, our core competencies according to our national needs. And another thing I will say that definitely competency is we can measure it by abilities, and we can measure it. Professor Sanjay said that knowledge, attitude, and skill, and that is true. We can even measure the knowledge. Where he is competent in the knowledge, but there are ways. It is not only that, skill is the only thing which we can measure. Let's say one MS resident is doing, he or she should be competent enough to do appendectomy. It is not that we can adopt this course in. I'll tell you later on. We can adopt this course in our public health curriculum also, because we can measure their behavior. We can measure their other things also. Saying so, and here, if you have time, please 5 minutes. I am from Pathan Academy of Health Science, and this is a new academy. And in our postgraduate course, we have adopted competency-based course. In MD, PG course, MDMS is fourth batch running, and then in MTS we have third batch running. And I'll read it out here what is the competency course of MPH, and then in MD also. That's why I'm telling you that. And sir said that it needs lots of work for the faculty. It needs trained faculty member, and we can do that. This is not a big deal because we can train our faculty. We have done that in my institute. We have done that, but it needs lots of work, logbook, and so many things, forms and other things. You have to fill it out, and then you have to read also. So sorry, sir. So if you give me permission, I am going to read out our curriculum MPH graduate for the pass. What we have said that at the end of MPH course, the graduate will be able to. We have 14 competencies. First, we have said that demonstrate the highest professional ethical behavior, commitment to social justice, human rights, and peace. Acts as a leader and agent of change to promote the health and development of Nepal. Trace and critically analyze the historical context and trends of health and health problems in Nepal, particularly since the middle of the last century, and relate these trends to underlying social and environmental causes. Trace and systematically analyze the health system development and relate these developments to change in measures of health of the population. Analyze and illustrate the social determinants and their links to biologic, ecologic basis of public health problems from local to global. I think social determinants, social accountability is the most important thing, and that we can measure whether my candidate is social accountable or not. It is not that we will measure the condition to me or policy to me. Another thing is that advocate and work within the political process effectively to improve the health equity, work effectively within the communities. And I want to tell you here that even in our MBBS course and even MPS course, 25% curriculum is in the community. So they have to go community, 25%. And it is applied concept, method, and tools for collective analyzing and interpreting qualitative and quantitative data, and publish submit findings and scientific conference journals, and also disseminate to communities and policymakers. Because previously in this UHC we have Ramesh Kumar. He said that no good data is collecting. I think we can train on that our this thing. And conduct community assessment, analyze, communicate, and use the findings. Then analyze quantitative and qualitative data, and elaborate information sources to address important questions that affect the health and well-being of population at the national and global levels. Prioritize, plan, and implement socially just and equitable programs. Conduct formative and summative program evaluations. Because the question was how to assist those guys. So we have hooked the formative and summative program. Manage the program to achieve and define set of goals through collaborative teamwork and partnership. And lastly, criticalize, analyze the policy and survive the policy. So these we have adopted in our engine, and we are working on that. So I think this was interactive session, and thank you very much, sir. And I'd like to thank organizer and especially president of this ISMR inviting me here, and then giving me the chance to share the session.
Thank you very much, Dr. Yadav, Dr. Yasmin, Dr. Pandit and Sanjay Zodpey for such an elaborate presentation and thought-provoking ideas, introducing terms like transformative education. Just to help, I like to say one sentence about myself. I can describe the whole procedure of appendicitis. And in my days, when I was a student, I knew every page number of book of surgery, 11 times. You tell me and I'll give you the number of the page where it is. Do you know, I cannot give an incision till today. So having knowledge and having a skill to do, these are two different things. Having knowledge is important, but performing is very important to deliver the science. So we have to not only focus on knowledge, but skill development. And I would like to say the soft skills that we are talking are necessary now for becoming a successful public health professional. With this, I will stop. Thank you all. Thank you all. Invite you for a cup of tea. Please be back. By what time? Mangal sir? 20 minutes. Dr. Mangal has some assignments for group work. We are not going for interactive session. We will be dropping that session to accommodate time and relieve you early. So just after tea, please come back here.